Before we jump into this week's episode of the Major Pain Podcast, I will remind you that I am not a medical professional. Please do not take any medical action based off what you hear on this podcast without first consulting your doctor. I'll also say that if you are enjoying Major Pain, we would love your support to keep the show going. There are several great ways to do so. The first is our ongoing Patreon campaign. Through Patreon, you can subscribe with monthly financial contributions that directly support this show's creation. We have 3 tiers of support: the $2 per month supporter tier, $7 per month patron tier, and $25 per month producer tier. Each tier comes with different levels of recognition on the podcast itself and gifts when you sign up. Our $7 per month patrons will receive a gift of a Major Pain coaster, and our $25 per month producers receive a Major Pain tote bag, both gifts made by my mom. Everyone who signs up on Patreon will gain access to monthly bonus episodes with myself and my partner Andy, where we talk about what's going on in our lives, updates on our health, and the movies and TV and books we are currently enjoying. You can learn more about our Patreon campaign and sign up to support this podcast at patreon.com/majorpainpodcast. Extra special thank you to our Patreon producers supporting this show at the highest tier of $25 per month: Steve Kavanaugh, Chris Fowler, Trish O'Brien, and Hipster Leia. Other great ways to support this podcast include clicking our affiliate links, which you can find in the show notes of this and every episode. That includes Rare Patient Voice, an amazing program where you can be paid for your time to participate in research studies and surveys. If you have a diagnosis of any kind or you are a caregiver, you qualify to participate in Rare Patient Voice. Sign up using our link, rarepatientvoice.com/majorpainpodcast. And if you participate in a research study or survey, you will earn an average of $120 per hour for your time. You can also support this show when you sign up for NeuroHealth. NeuroHealth is an online headache and neurology clinic where you can get the care you deserve without the wait. Head to neurohealth.co/majorpain to get a discount and support this podcast when you sign up. Or you can head to our Amazon shop, amazon.com/shop/majorpainpodcast. Our shop features products that I use to manage my chronic illness, and Major Pain will earn a commission on any purchases from this shop. Or you can start any Amazon shopping trip from our shop, go on to Amazon, purchase anything at all, and this podcast will still earn a commission. Follow Major Pain on social media. We are on TikTok, Instagram, YouTube, and Facebook, all at Major Pain Podcast, where you can leave a comment on any episode and interact with other listeners of our growing community. And of course, don't forget to leave Major Pain a positive rating and review wherever you get your podcasts. We are on Spotify, Apple Podcasts, and most major podcast platforms. This show is intended as a free resource for anyone going through chronic illness and disability, to build community around experiences often lived in isolation, to break down the layers of societal ableism, and to help you navigate for your own personal health equity, and also just have a lot of fun. Thank you for checking out the Major Pain Podcast. Let's get to today's episode.
How lucky it is just to get through a day without pain.
If you look at me, it doesn't appear that I have a disability.
A test that comes back abnormal, it's like, yes, we're onto something here.
Welcome to Major Pain. I'm your host, Jesse Mercury, and this week I am joined by our guest, Maureen. Maureen, welcome to the show.
Hi, thank you. It's great to be here.
I'm so excited to chat with you. And as you can hear, the intro is a little different this week. For the first time ever, Major Pain is available as a video. Maureen has been so kind to be our guinea pig this week as we test this out. So this episode is available on YouTube if you'd like to watch as well as listen. So let's get to know our guest, Maureen. Why don't you tell us about yourself?
So I'm your regular kind of 32-year-old. I live in the Midwest. I enjoy things like hanging out with my nieces and nephew. They live super close to me, which I just love getting time with them. I have a bachelor's in marketing with a specialty in digital marketing. So social media is really kind of like my bread and butter that I'm very interested in. I currently actually work for our family business as operations manager for a couple of retail stores.
Wow.
And I'm able to do that from home, which has been a blessing. And I also, in my free time, love to do nail art, passion project of mine that I enjoy doing. And so I have a little area set up for me to do that. For the most part, just living every day like it's your last. I had lost my dad back when I was 22. So
I'm sorry to hear that.
Yeah, it was sudden and unexpected. And so it just kind of propelled me as well as my whole family to just live every day like it's your last, enjoy it, and just remember to laugh, because that's really best way to see everything and not get too worked up about anything too small.
Yeah, that's so interesting how going through that personal trauma changed your mindset. So now you just want to live in the moment, experience the day. And it's
Yes.
so important. That is such an important thing. I was talking about that exact thing last night with my partner, Andy, about how the more we can live in the moment, the more you actually experience your own life and enjoy your own life. And it's so easy to let life go by you as you are being anxious about the future or regretful about the past. And it's a very difficult thing to learn, and it's so foundational. And I hear it all the time from guests also that, as you go through health challenges, one of the ways to manage that is to learn how to be happy and comfortable in the moment that you're in every individual day, which is a practice and a challenge. Absolutely.
Yes.
Well, I'm very excited to get into your story today. Maureen, what is your major pain?
So I am actually diagnosed with Ehlers-Danlos syndrome. I have classical type. There are 7 different subsets of it, but I'm with classical. Most common is usually HEDS, which is hypermobile. I also have MCAS, which is mast cell activation syndrome.
Oh, wow.
POTS, postural orthostatic tachychardia syndrome, fibromyalgia.
Wow.
Endometriosis, and I'm actually currently being tested to see if I have Charcot-Marie-Tooth, which is, there are a couple of different kinds. So this one, they're looking for the genetic factor. So I have been to a lot of specialists and diagnosed with a lot of different things throughout the years. I've learned a lot of stuff, how to find the right doctors, how to do a lot of those things to make sure that my care team is really, I call it my dream team, because with all these different conditions, you do need that help. Finding that team can be difficult, but it is very important, and just not to give up on it.
Yeah. Wow. You're an overachiever. That is a lot of diagnoses.
Yes.
And things that I'm familiar with as well. And one of which I actually have. I have mast cell activation syndrome. So that one I'm very intimately familiar with. And also fascinating, you have the classic Ehlers-Danlos triad.
Yes.
EDS, POTS, and MCAS. But you have classical EDS. So, I think we've had a bunch of guests with EDS, but I think only one that I can remember off the top of my head with classic EDS with the genetic testing. Do you have genetic testing for that?
Yes.
Wow.
Yeah. So I lived in Maryland. So I was on the East Coast, and I was in Maryland for about 7 years before I had moved to the Midwest. And I was lucky enough that my doctor just took one look at me, first appointment there at my new patient appointment. And he's like, I think you have EDS. And he sent me to Johns Hopkins. Yeah. I have to say, I'm probably one of the more blessed ones in the situation. Usually it's a lot of people fighting for that diagnosis, saying I know I have it. My doctor, he's very heavy into research. He loved researching, learning new things. So he was the one who said actually, my mom was with me at the appointment, and he goes, I could write a book about your daughter just with all the health stuff. And it would be very fascinating for a lot of people to learn about. And so he said, I think you have EDS. He sent me to Johns Hopkins genetics department, and I did the genetic testing. And from there, they found out that I had classic EDS.
Wow. I'm shocked. I'm like literally speechless. I don't know if I've ever heard that before, that someone went into a doctor and just walked right into that diagnosis. It's usually such a battle to get a doctor to take you seriously at all, let alone get a diagnosis that quickly.
I know. And I was, like I said, I was very lucky that he's very into research. And so him just took one look at me, and he's just like, your history, he didn't look at it as each symptom. He looked at it, the big picture. He took a step back, looked at the whole picture, and said, I think you actually have EDS, so we need to get you tested. And so that was a blessing, because usually everyone comes in, they're just like, I have all these problems and I don't know what it is. But for me, I just thought, okay, this just might be normal for me. This might be just a part of my everyday life, because it all started with I had spondylolisthesis. And then from there, everything just kind of progressed. And I was like, okay, this is just probably normal. And it wasn't until that doctor, he said, all those things separate are already bad, but then you put them all together and he goes, I think you have a diagnosis. And I was just really grateful.
Okay, let's get your timeline straight. When did that happen with the doctor that you got this diagnosis?
So that was back in, I want to say, end of 2016, beginning of 2017. I had just moved there for work. And so I was working as a floor manager there at one of our businesses. And it's a physically demanding job already. And so I was just starting to get worn down a little bit more, having more aches and pains. And I needed a new GP. And so I had found them through Dr. Blurb shopping, where you look and you kind of read through all of their different history, and then and another pharmacist actually also said he's a great doctor as well. So that, with his previous history and that recommendation as well, I was like, okay, well, I'm going to go see him because he sounds great. Yeah. And so 2016, 2017 is when I was diagnosed with EDS. Okay.
So it's been like 7 or 8 years since then. Yes. And then when did you have the spondylolisthesis?
So that was actually in high school. Wow. For the longest time, we just kind of thought, oh, it's growing pains. You don't realize that it's like, oh, I have extra growing pains. And a lot of people with EDS have very good core memories of, oh, I had really severe growing pains.
Absolutely.
And a lot of times it's because your body is growing faster than your collagen can support, and we already have poor collagen. So all those connective tissues struggle to keep up with your growth. So a lot of people find that that's a core memory for them, I would say. And then in high school, I just kept having these back issues. And it started because I was having gait issues with walking. And then I had a full spinal MRI. And then they saw that I had stress fractures in my lower back. Wow. With spondylolisthesis. Yes. And so I was put in a sternum to tailbone back brace, hard back brace, 23 out of the 24 hours of the day, to hope to build up some cartilage around it to help it. And then and that was my senior year of high school. And then when I went off to college, about a year and a half into college, I slipped on a patch of black ice, and it caused that grade to go from a 1 to a 2, which pinched a nerve. So I had to get back surgery to bring it back, stabilize that lower back. And then from there, just kind of, it almost kickstarted a lot of the health issues, I would say.
Yeah.
So it's just something that I found fascinating, because one major health issue can then impact that down the road. So
yeah, it's so interesting looking back once you have your diagnostic picture together, to look back through your life and think about, well, how is this affecting me? So Ehlers-Danlos syndrome is gaining a lot of awareness in society, where, just a couple of years ago, no one had heard of it. But in case you're unfamiliar, it is a connective tissue disease. So your connective tissue just works a little differently than someone born without Ehlers-Danlos syndrome. And the spondylolisthesis, can you remind me the definition of that? I remember it's something to do with the low back and a bone being like slightly out of place.
Yes. So spondylolisthesis is where it has stress fractures in the lower back, is usually one of the indicators, as well as it essentially, so it's your tailbone and like one of the vertebrae, and it'll slip a little bit forward.
Yeah.
And so, as well as that, I also had pretty severe lordosis, which is where you have a sway back. So that spine's going to curve kind of, you have that normal curvature, and then the lower back just goes in a bit.
Yeah. Wow.
Yeah.
I've never heard of that one before. So, I mean, basically your connective tissue is not supporting your body as you were growing. And it seems like, oftentimes with EDS, when you become a teenager, late teenage years, early adulthood is when you really start to notice, something with my body is not adding up. So then it sounds like, you were experiencing that for years, with several issues coming up and things that you had to address throughout your life. And in high school, I mean, that must have been very difficult to have something so visible happening in high school.
It was difficult. And And I always told my mom, her and I talk about it a lot, and she's actually a huge fan of your podcast as well.
Hi, Maureen's mom, who also
So,
connected us. Thank you so much.
yes, yes. So I talked to her a lot about it. It was difficult, but I learned from a young age that, okay, this is going to probably be a part of my life. It's going to have an impact on my life. So I had to make a conscious decision to not let it impact the emotional, I guess the emotional state of me. I don't want it to, I guess, drag me down. Because while it was difficult to deal with, especially senior year, I was playing lacrosse in high school. I couldn't play my senior season because of it. So it was tough, but I just said, all right, my life is now going to be different, but I can't let it change who I am, how I enjoy life, and I guess the lessons I can take from life, really, because I always said, there's someone out there that has it worse than me. So I'm grateful for where I am in my current journey.
Yeah, it's amazing how health challenges often awaken gratitude. And it sounds like that process started young for you, which is very impressive. Took me a while,
Yes. Oh, yeah.
I didn't start being grateful for quite a while.
No.
I was very angry for a long time. How old were you when you were diagnosed with EDS?
I was 23. Yeah, I was 23 turning 24 when I was diagnosed. And it was kind of interesting because we kind of had this theory that, you always wonder why people have passed away suddenly, unexpectedly. And that's how we were with my dad. But after he had passed, I then had to fully take over the business, do everything that he was doing, running payroll, taxes, running the store, at that storefront level. And so that caused me to have to move out to the East Coast. And that's when I met the doctor, who took one look at me, is like, I think you have EDS. You probably have POTS as well. And there may be some other things, but we'll just kind of keep an eye on them as we go along. And so it sucks that we had to lose my dad, but in a way, he kind of also saved me, because we believe he had it too. He and I are built the same stature. We walked the same way. Our gait was the same way, tall, broad-shouldered, and he had a lot of back issues, but he was the type to say, I don't want to go to a doctor except for my annual physical, because if I go, they're going to find something anyways. And if it's not bothering me, I don't want to worry about it. So
yeah. Wow.
Yeah.
That's so interesting. And yeah, it seems like you're someone who really takes a step back and looks at the big picture when you're going through something difficult.
Yeah, and I do have to credit my family, because growing up, I was bullied for my size, my weight, everything. And it was very severe, to the point where, I had to be in therapy, had to be on medicine to help keep my emotions level. And so I credit my parents putting me into therapy right away, saying, we need to make sure that she's always okay. And so a lot of the tools I've learned at a young age, I've applied to my life. Every time I get a new diagnosis, every time a new issue arises, I keep those tools in the back of my mind and keep using them, because things could be worse. So I want to be grateful for where I'm at now.
Wow. I'm so sorry to hear you went through that bullying. That's awful. So you get this diagnosis at 24. How does that feel? Is there a sense of validation there? Because it sounds like you knew already something is going on. I'm in this pain. My body seems to be maybe bendy or stretchy in ways that other people's aren't. So what is the emotion of finally having that answer?
It was kind of funny, because my mom went with me, and my doctor joked with me. He's like, what? You're 23, about to be 24. Why do you need your mom at these appointments? And a lot of the times it's because I have so many issues, I sometimes forget. So it's always helpful to have an extra person with me, as well as she's a big patient advocate for me. Anytime I need help fighting for something, she's there to do it for me, which I'm grateful to have. But after that appointment, we go outside, we sit in my car, and we're just sitting there, and we're just like, that makes so much sense. Everything now clicked into place. And
Yeah.
and then we could attribute it to so many different things that happened to me growing up. I had broken and sprained both my ankles multiple times, a lot of those different things. So we just sat there and we kind of felt like, oh, this is a good thing. It's a bit difficult because he did warn us, EDS is not something you can cure. It's a lifelong disorder you'll have, but it just made sense that we could finally, that relief that we could finally put a name to all the issues that were starting to build up for me. So that was really big.
And it sounds like it also opened the door for some other diagnostic avenues. Your doctor mentioned POTS, postural orthostatic tachycardia syndrome, which is really on the rise. A lot of people think maybe due to, long COVID symptoms.
Yes.
But basically, if you get really dizzy when you stand up and your heart rate skyrockets when you stand up, you might have POTS. So is that something that you then went into testing for? Did they do a tilt table test?
So he didn't do a tilt table test, but he actually thought that I had it because he saw me stand up from sitting on the examination table, and I stood up to get down, and I had to stop myself because it started to sway a bit. And so he goes, did you just get really dizzy right then and just kind of feel like your stomach bottomed out and your body just felt really heavy? I was like, yeah. I was like, oh, it happens. It's been happening to me since I was young. If it's really bad, when I stand up, I would get like a pinhole vision, or a couple of the really bad ones, just my whole vision would black out. But I would just be standing up completely normal, but I just couldn't see anything. And I would have to take a couple of seconds to kind of regulate my body, and then I could start moving again. He's like, I don't really think I need to send you for further testing. He goes, I'm positive that you have POTS, because he witnessed it. Witnessed me standing up, swaying a bit. I had to hold on to the table for a bit. And so, like I said, with his doctor, I was very lucky. Very lucky.
Totally. And POTS is often, comorbid with Ehlers-Danlos syndrome. So that makes a lot of sense. Did he put you on any medication for that, or did you do any lifestyle changes to manage POTS?
Yeah, so he did put me on medication. And so I am on a beta blocker as well as a sodium tablet, which I am lucky and very blessed that has helped manage it. So I haven't really had severe issues with it. It does sometimes flare up, and I have to take extra precautions, take a couple sips of pickle juice to help with that sodium level. But he did get me on that right dosage. We worked well together on making sure it's like, okay, how do you feel with this much, or if we had to lower it? So I was lucky that, again, like I said, I'm blessed that it worked for me, because I know so many people can be on the medication and it won't really work for them. And so they'll have to do lifestyle changes, as well as some have service dogs for it. So that, in that aspect, I always say I'm blessed, and I always feel for people who don't have that same experience.
Yeah, absolutely. Yeah, so sodium intake can be something that's huge with POTS, upping your sodium intake. And I don't remember why, but we have a couple of really great episodes about POTS in our back catalog. Michelle, early on in the podcast, I think in the first season of the podcast, we did an episode on POTS with Michelle that is so informative. And she also talked about ways that you can do an at-home tilt table test. Although, obviously, doctors are better than what you can do at home. I actually thought that I had POTS, and then I did the tilt table test. Turned out I had small fiber neuropathy and not POTS, which is also a form of dysautonomia. But yeah, I'm glad to hear that you found something that can help. And it's so funny, this idea, like, pickle juice, pickle juice helps with my POTS, but it's salty, and that'll definitely up your salt intake quickly. Although pickles are fermented, so there is that aged factor that can affect MCAS. I know, because I'm on the low histamine diet. When did MCAS come into the picture?
So MCAS didn't come into the picture until I had moved to the Midwest. I'm in Kentucky, so it didn't come into the picture until I moved here about a year and a half ago, I would say. Um, I am very lucky that in my area, in the same network as my GP, they have an Ehlers Clinic. And so right now they are just focusing on the hypermobile because that is a lot of times the most common, as well as because it can't be genetically diagnosed.
Yeah.
It's to take on patients that think, well, I may have it, I may not, or it could just be HSD, which is another like hypermobile syndrome, so not necessarily Ehlers, but you're still very hypermobile, which is still another big risk. So you have to monitor those well as well.
Yeah.
But I was very lucky that they had that. And so my doctor has so many resources, and I was actually able to get in contact with a couple of specialists. So my cardiologist he has an autonomic disorder clinic that he runs. So I see him through that for the POTS. And then I was sent to Cincinnati. I live close to Cincinnati, which I'm very lucky because great hospitals, great doctors. And my immunologist there is the one that diagnosed me with MCAS. He says I present a little weird because he ran all the blood tests, the different typing tests and everything. And I was on the higher end, but not outside of the normal range.
Yeah.
But we did also other tests. So I'm on Zyrtec, 20 milligrams twice a day, as well as Pepsid, 20 milligrams twice a day. And he goes, the tests show, okay, you could be, but because I'm seeing positive results with the medication, he's like, I lean more towards, yes, you do have it.
Yeah.
And it's hard to diagnose because a lot of the times you can't test positive with it unless you're going through a flare up, or you have to do those extra tests that not a lot of doctors know about. You usually have to see a specialist for.
Yeah, and even if you test while you're having a flare-up, if you get the timing wrong, it'll still come back normal. I'm in the same exact boat. We have never captured a positive test result for me. We have a bunch of evidence in other ways. I had a blood allergen test that was just off the scale, which is what sent me to the allergist who diagnosed me with MCAS in the first place. But for me, it was the same. It was trying the medication and seeing what happened. So you're on Pepsid and Zyrtec, which is an H1 and an H2 antihistamine. And if you look into, MCAS, which is, of course, mast cell activation syndrome, which is a dysregulation of the white blood cells that generally deal with allergens. And they start just kind of releasing chemicals in your body all day, every day. Or, they just kind of get hyperactive. So having that full histamine blockade, H1 and H2, is sort of the first line of defense. I'm on a huge amount of medication for it, but it's completely transformed my life. And just looking at me before and after, my doctors could physically see what a huge difference it was making. And that's when I got that diagnosis. So for me as well, it is a clinical diagnosis, which is, what matters is what is the effect on your life? What matters is this helping you? And if it's helping you, then that is great evidence that we're on the right track. But it sounds like we jumped over some of your history there. We jumped from the POTS to the MCAS. So now we know about the trio that, EDS, POTS, and MCAS is often referred to as the Ehlers-Danlos triad, which, again, we have a great episode about early on in the podcast with Maureen, which is where I've learned all of this stuff from, which is so much fun for me because it's been so helpful in my own personal chronic illness journey to learn so much from our guests that I can then apply to my own life and talk to my doctors about. Of course, this show is, as I always say, this show is not intended ever as medical advice. Please do not take any medical action based off what you hear on this podcast without first consulting your doctor, which is what I've done. I've taken what I've learned from this podcast to my doctor, and I've seen just incredible change because of that. But let's back up. So after POTS, you mentioned a few other diagnoses in there: fibromyalgia, potential Charcot-Marie-Tooth. What was next after POTS?
So actually after POTS, it was more so trying to understand Ehlers because it is a very complex disorder despite being diagnosed. There's so many different systems of your body that can be affected by it that you really have to every day kind of take it day by day, really. With that, I was working more hours. I was working probably 60 hours a week, and it was really starting to affect my body, my energy levels. I mean, the biggest thing is really those energy levels. So I was having issues with, joint pain, just a lot of throbbing. I do have permanent nerve damage from spondylolisthesis. It pinched a nerve, and my doctor couldn't get me in to surgery quick enough. So they were hopeful it would heal. However, I found that my nerves don't heal as well. And there's no research on it, but I have a theory, because I did go to school for pre-nursing before I switched over to marketing. And so I have a really big interest in the medical field. So I did my own research, and it was kind of surprising to see how many people with Ehlers have a lot more nerve issues. The nerves don't heal as well. About 70 to 80% of people with Ehlers have fibromyalgia. So looking at those things, trying to implement different things into my life that could help make things easier for me, whether it is accessibility tools or, even I've been in a lot of physical therapy for a lot of issues, using those exercises, even if there are no issues with me currently. And then also another big thing is that I had a personal trainer. I would go to the gym and I would see him, 2-3 times a week. And I have to say, during that time between the POTS and the Ehlers diagnosis and then moving out, I think it really did kind of save me from having a lot more issues, because I was working on keeping the muscles strong around the joints, keeping up that flexibility in terms of making sure I am sitting in the proper way, which is, you don't think normally, okay, am I sitting correctly? But with Ehlers, it's a big thing to make sure that you're sitting properly, activating the correct muscles to help support you, standing, sitting, getting in all to the different positions. And so I have to say, I'm very blessed and thankful for my personal trainer, because he was very aware of different issues. And so he knew how to handle my case specifically, because he has had all different clients and has specialized in those different exercises. So he wouldn't push me too hard, because you have to find that balance of just enough, but not too much. So.
Oh, it's so hard, and it's so crucial.
Yes.
And that's so important with MCAS as well, because if you exercise too much, you can actually cause your mast cells to flare. And if you don't exercise at all, you can cause your mast cells to flare. So there is that narrow pathway, and I'm still searching for it. I'm close to 2 years of having this supposed and then confirmed diagnosis, close to 2 years of treating this thing. And I'm still trying to figure it out. It's so difficult to find that perfect place to be. And if I'm also like experimenting and going back to work after being on disability, and it's so difficult to find the right amount of work to do. And last week I did too much, and I got really sick, and it took me days to recover. I'm still kind of getting on my way back up. It's so frustrating. It's just I want to do normal human activities and not have them make me ill. And I don't want to have to do all these calculations constantly of how much is too much and how much is not enough. But it's unique to every individual. And that's another part that makes it so incredibly frustrating, is that you can't just ask a friend. You have to ask your body, and you have to learn how to talk to your body and be in communication with this, somatic self that we all inhabit. It's very complicated. What sort of physical therapy exercises can you recommend to someone with Ehlers-Danlos? What are some examples of movement that helps you to strengthen in places where Ehlers-Danlos can make it, maybe a little bendy or loose?
Right. For me, a lot of the times working with the bands that they give you from physical therapy, and the nice thing is that you can buy them online. Honestly, you can probably find them anywhere, but they have those resistance bands are very important. Utilizing them so that it's not too much weight, but it still gives you the resistance. You're able to build up some muscle. A lot of exercises I focus on were around the shoulders, because my job when I was working on the floor was a lot of putting stuff on shelves, pulling them down, using a lot of different range of motion. So a lot of exercises where, you use the resistance band, you pull them and you just kind of pull, you would take it and you just pull it out like this, really saved me, as well as exercise ball. So when you sit on the exercise ball and you do a lot of marching, leg raises, and keep it stable, it activates the core, which is very important for people with Ehlers, especially if it's affected your back or spine in any way, kind of keeping that core tight. And I think the hardest one for me is a lot of the exercises around that utilize the shoulder blade muscles. So you don't even have to have any items or tools, any kind of exercise equipment, just learning to pull down the shoulder blades in the back on your back muscles, raising them up, pushing them out to the side. And so that helps a lot of times with the shoulders. That was mainly one of my issues or my areas of concern were the shoulders, as well as knees and ankles. And it's nice, in today's day and age of the internet, we're able to look up a lot of these kind of exercises that are out there. But what really did save me were kind of the exercise bands, as well as weightlifting with my trainer, but he was always there spotting me. So unless you can have someone with you training you who knows what they're doing and spotting you in the proper position, I don't know if that'd be the best idea for some people with Ehlers, but every day, even if I'm at home, even now sitting, I'll just pull out the exercise band and just use it for my ankles, kind of doing the up and down motion, side to side, just to keep your ankles. And then also knees is a big thing too. Having it connected to, tied around a table leg and then behind your knee, and just kind of let it pull you forward and then straighten it a bit, but not so straight that you're hyperextending. That's a big thing that you have to watch out, is hyperextending those joints.
Yeah, great experience to share. Thank you.
Mm-hmm.
Okay, so you spend some time learning to live with this new diagnosis that you have. And then what was your next diagnosis?
So then after, I would say about my last year living in Maryland, I was getting these upper respiratory infections every month, sometimes even every 2 weeks, to the point where about almost 2 years I was on antibiotics and oral steroids at least once a month, sometimes two if it was really bad. So that is actually what led me to MCAS. And my immunologist here told me that what's so difficult about MCAS, and I'm not sure if you've experienced it, it can affect some systems and not others. So my MCAS is mainly focused in my lungs and respiratory, the upper respiratory area, the gastrointestinal, which is also compounded with Ehlers, because a lot of people with Ehlers do have GI issues.
Absolutely.
And then also I would sometimes get hives and rashes.
Yeah.
But then other things wouldn't bother me at all. So it's so difficult to say.
Yeah. And that's so common too with MCAS. Mm-hmm. It is a multi-system disease, but it is sort of like, body roulette to see which system it affects.
Yeah.
And that's part of why it's so hard to diagnose, is because no one is looking between the lines. That's why you're so lucky with this doctor. It's incredible. This person who's looking at the big picture and saying, okay, well, hives plus GI issues plus upper respiratory issues, what could cause all three of those? MCAS absolutely is something that could cause all three of those.
Yes.
Okay. So you get that MCAS diagnosis, as you discussed with us.
Yes.
And once you started this histamine blockade, what sort of a difference did you notice?
I have not had another upper respiratory infection or issue since I've started it. It has really done a good job. They did start me on Trelegy, the inhaler. So it's a combination of 3 different medications. One, it's like an albuterol because it does the immediate that steroid to help with the inflammation of the upper airways. Then it also has a medication to maintain that for a full 24 hours to keep the airways open. And as well, I can't think of the third one off the top of my head, but I think it's for preventative, so that it kind of stays in the airways so that you don't have that issue come back again. So he started me on that if I felt like it was starting to happen, and then immediately it would stop it in its tracks. Wow. And that was just when a severe case would happen. The GI issues have been a bit more difficult to kind of regulate, and that's also because it could be food that you're eating, anything you're drinking. Also, as weird as it is, just any particles in the air too. Some go in your lungs, some may go down to the stomach, so you don't know. And then also, I actually just had brain surgery last month. So,
oh my God.
Yeah, I had hydrocephalus, and I don't think it's related to Ehlers or MCAS or POTS or any of those. It just kind of, I went to an annual eye checkup, and the doctor said, I don't like the way your optic nerves look. Send me to a specialist. They said, we need an MRI because I don't like the way they look. And then after that, they said, yep, you have hydrocephalus. We need to get you to a neurosurgeon. So it happened all really fast. So
what is hydrocephalus?
So it's extra fluid inside the brain. So there is within the brain, there's a fluid that's inside your spinal fluids in there. When you have hydrocephalus, there's too much, which can cause swelling in the brain, swelling of your optic nerves, which can result in vision loss. It can impact other things as well, because it's essentially a balloon that keeps kind of overfilling, and so it's going to push on the brain as well. So you have to be mindful of that. So I had a shunt placed, and again, it kind of goes back to the MCAS because it drains into your stomach. And so with the GI issues, it's kind of caused another flare up. So I've been working again with my immunologist to get that more regulated so that it doesn't always cause a flare up when it decides it needs to drain some fluid.
So you have a shunt draining fluid in your brain into your stomach?
Mm-hmm. Yes.
What's the physicality of that?
Yeah, so it's up
look
here.
At that scar.
Yeah.
I'm so glad we're doing a video episode.
I know. Yes. So this is still healing. Yeah. Wow. So it's still healing. But it is a mechanical shunt, so you can program it to how much fluid needs to be inside and center. And then if it's too much, then it will cause it to drain the fluid. And so there's a tube that's under the skin, and it goes over
my God.
Yeah.
I've never heard of anything like that. A tube that is under the skin, and it goes from your brain to your stomach.
Yes.
Is it visible under the skin?
No. So there's some areas you can feel it. So you can feel the tube behind my ear, and then there's a certain area you can feel it around here. But then as it goes down further, deeper into the skin, you can't really feel or see it. But then again, it also causes issues because with Ehlers, your skin doesn't heal as well, and they have to do a few incisions to make sure it's tunneling to the right areas. And so healing with that, I always have to warn doctors or surgeons to be like, when you're closing me up, you probably need a couple extra stitches because my skin does not heal well. It also doesn't always stay closed. I've had, I would say, about 2 or 3 incisions that have reopened after they've taken the stitches out after that 2-week mark. So you always have to be cautious of that. Yeah.
Yeah. And also, I mean, I have to be so careful about what I put into my body. With my MCAS, I'm so sensitive to histamine in food. I take a Dow enzyme to break down histamine, and I eat a low histamine diet. I take chromolan sodium before every meal, and it's just all such a pain. And that just makes me think, I wonder if brain fluid is high histamine.
I know. Yeah. It makes me wonder too. But
like you're draining this fluid into your stomach. I wonder, I mean, what does that do to MCAS? Can you have a a histamine reaction to your own brain fluid. We're getting into things that need to be studied here.
I know. Yeah. So it's been a journey. It's probably been the roughest surgery that I've had.
Sounds pretty rough.
Yeah. So it's been the roughest because healing. It's been uncomfortable healing, as well as with the MCAS and with the fluid going into the stomach. It's just all randomly. I can tell you when it's draining because I'll just randomly start getting nauseous, and so it's been a balancing act. But like I said, I'm very blessed with the doctor that I have. He's working with me, and we're trying to figure out the best way.
I'm sorry to laugh, but
that's okay. No, please do.
You keep describing these things that sound awful, and then ending with, "And I'm very blessed," and it's very impressive. I mean, what an incredible mindset to have. And it's also, the mindset that you live with inside of chronic illness is so important and something that I think about all the time. And it's one of the areas that we have the most control over, even though it feels like we don't. And I just started, with a new therapist recently who is a cognitive behavioral therapist, which is something that I've resisted for many years because I was always told, oh, well, you are not sick. You need cognitive behavioral therapy, which was not true. And it made me so mad. And now that I am being treated for my illness, I'm like, okay, well, now I can take a look at cognitive behavioral therapy because, I just knew that to do it the other way around, I would never get a diagnosis. That's just how I felt about it. So, but I'm learning so much that is so helpful about how to sort of process and cognitive distortions, which is, things that you think are happening without actually confirming that they are happening, which is so helpful. Being able to sort of stop your thoughts and examine your thoughts and redirect your thoughts is very important. And you can build pathways if you redirect enough to sort of change the way you think. And it seems to me like you have built gratitude into your brain. Has that been a conscious effort?
Yes. Yeah. Like I said, from a young age, I've been in therapy and I've had quite a few therapists throughout the years as well, because the biggest issue with chronic illness and the illnesses that I have is that I always call them, it's kind of like an invisible monster. Because if you looked at me, you wouldn't see anything wrong with me physically. I've had some surgery, so I have some scars, but you can't see them. And then the biggest thing is that all of my pain is on the inside. So no one else is going to think. And a lot of the times too, with Ehlers and with a lot of these other health conditions, we have a higher pain tolerance. So a lot of the times people don't even believe that we're sick and they think it's actually in our head. So we have to go to therapy. And a lot of times you have to find that right therapist too, to say, no, this is definitely not in your head. There's something physiologically wrong with you, not psychologically. And that's a lot of the battles that a lot of people with the conditions deal with. And so it's always been, and my new favorite word is fascinating. It's always been fascinating to me because everything new that happens, I'm just like, oh, that's fascinating. Because we don't realize just how much, yes, there is something to be said about therapy helping with your physiological pains, but you also have to look at the other side. Physiological can really impact your mental state. So that's why you need to figure out that balance. And so if anyone says, I always say, therapy can help just because you are now going through something that people may not believe you have. And so it will be difficult. You may not have a support system. Again, I'm blessed, like my sister, brother-in-law, my mom, they all acknowledge and say, yeah, you have these physical ailments. So I have that support system. And so, and not a lot of people do. And so trying to get yourself into a better mental state can help, because it can be daunting when you feel like you're on your own. And I've had days that I felt like that, because no one else can understand what you're going through. And I'm sure you do too, because you think, oh, this randomly something can cause a flare up. Or I know right now I'm going through kind of a flare, is what I like to call it, because I'm feeling more pain these days. So it's just like, you have to do some extra work on your mental state, like a mental health checkup. And if you can find someone to help you with that, I just think that is invaluable, really.
Yeah, incredibly well said. It's crucial. And I wish that doctors hadn't presented CBT to me as an either or, because it prevented me from doing it for so long. And it's so helpful. And my therapist actually has a chronic illness, which is, incredible. So she gets it, which is really, really helpful. So yeah, I mean, don't wait to seek out therapy. I really feel like it would have helped me. I mean, it's helping me now so much, and I do feel like it. And I did do therapy before, but sort of on and off. And then I've had a therapist who is amazing, who ended up becoming my couples therapist, which is just so helpful. Like, me and my fiance have been in couples therapy for years, and we love it. It's just a great way to check in on the relationship, and relationships are so important. And when you're dealing with chronic illness, you have a third thing in the relationship that you have to learn how to navigate. And that's why we started therapy, was to learn how to navigate my chronic illness. And it's, and now we're engaged, so it works. So yeah, so I've had therapy in my life for years, and I just restarted recently with my own private therapist doing cognitive behavioral therapy, which I'm really enjoying and I'm finding very helpful. And it's giving me new ways to sort of approach and reshape what I'm experiencing, because I'm finding that getting better and having a diagnosis and having medication, going back to work, I'm dealing with way more anxiety than I had when I was super sick and in this state of acceptance, Now things have changed so much in such positive ways, and it's hard. It's weird. It's like, why is it so hard to be getting better? But it's this fear of getting worse again, and then finding that balance, like we talked about, of walking this narrow road of what can I do, and then running into a lot of barriers that are frustrating and having to pull back when I'm trying to push forward. So yeah, very, very helpful. When were you diagnosed with fibromyalgia?
So I was actually lucky enough to go to the Mayo Clinic for their Ehlers Clinic.
Wow.
Yes. And so I had gone there. It'll almost be 2 years come September that I went, and I was just explaining to the doctor there, because it's a full day. You go there, you see a bunch of different doctors or specialists, and so you see like a physical therapist, occupational therapist, the actual doctor who kind of runs the clinic, as well as like his nurse practitioner. And so you kind of get a full overview of everything that comes with having Ehlers and all these things. And he had told me, as I was explaining to him, I said, I have all these extra pains, and I always thought, there has to be some connection between nerves and Ehlers. And this is kind of where I kind of medical geek out. So when I did some research, it showed that, so the myelin sheath around a nerve is made up of collagen, which people with Ehlers struggle to develop.
Wow.
And it's collagen type 6. And a lot of people with Ehlers aren't tested to see if there's something off with that. And I have had issues where my nerves don't heal. 70 to 80% of people with Ehlers will have fibromyalgia. So that's when he told me that a lot of my symptoms, he said, I believe, is fibromyalgia. And I just kind of geeked out and started researching, okay, is there a connection? There has to be some kind of connection, because people with fibromyalgia don't always have Ehlers, but people with Ehlers, majority of the time, have fibromyalgia. So it's like, there has to be something weird. And so I found that collagen type 6 is on the myelin sheath around the nerves, which is essentially the insulation for the nerve, so it doesn't go haywire. And so I'm like, all right, but I was never tested to see if there's something wrong with any of my different type 6 collagen. So it's like, could there be a nerve Ehlers-Danlos where those are mainly impacted? But the thing is that there's so much research that still needs to be done. It'll probably be down the road before we even consider that option. But I had spoken to a neurologist actually at UC Health that thought it was an interesting concept, because he agreed there is collagen on your nerves. So we just have to be mindful of it.
Fascinating. Yeah, that's so interesting. Oh my God. This also opens up an interesting discussion of how we label the pain that we are experiencing. Because people with Ehlers-Danlos syndrome often have chronic pain because, things are bendy and twisty, and, it's very easy to have issues with your joints and things get out of alignment. But also interesting to think about classifying widespread chronic pain that you have as Ehlers-Danlos pain or as fibromyalgia. What are your feelings about that? Why does it matter what we call our pain?
I think it matters because it's to give people that kind of sigh of relief to be able to be diagnosed and say, okay, so it's part of a bigger problem. I think being diagnosed with either or is very good. So that way doctors know and are aware that you may have a higher pain tolerance. So I have always kind of struggled. You get those typical answers of, okay, what's your pain on a scale from 0 to 10? And it's difficult for me to answer because honestly, I don't remember what it feels like being a 0 anymore. I have not lived a day not being at least, a 3 or 4, but and they always say, who's to say that my 3 or 4 isn't someone else's 7 or 8?
Totally.
And it's just, you can't figure that out. So I think whether we get a diagnosis, if the pain is from fibromyalgia or if it's from Ehlers, letting doctors know, hey, I've been diagnosed with this, so please keep in mind, because that can also change and impact, how pain management is done, which is a huge part for people with Ehlers. It's very difficult to get that proper pain management care just because I have a higher pain tolerance. And a lot of the times doctors say it's because it's compounded. You have both Ehlers and fibromyalgia, so you're just used to the pain. So I can show me just sitting here, just talking and everything. And, for me, it's like, okay, I'm at a solid 4 right now, but my solid 4 could be someone else's 6 or 7, like I said. So being able to diagnose that, then doctors like, okay, you've been diagnosed before, we should take that into account. Yeah. I think right now, though, that is the difficult part. So whether we're diagnosed with fibromyalgia or Ehlers-Danlos, I do think that is going in the right direction. And so it's just a matter of time, I think, before we see all the different connections, because it's still very early on in its research days.
Yeah, absolutely. There's more that we don't know about fibromyalgia than we do know. And that's something that I was diagnosed with for a while. And then when my condition worsened, we basically went back to the drawing board, got the MCAS diagnosis. And for me, the MCAS meds really help with my pain, which is, again, like evidence that we have the right diagnosis. But it's so weird, antihistamines treating neurological muscle spasming and chronic pain for me. It's, who knew I needed to go to an allergist, So I'm no longer carrying that fibromyalgia diagnosis. But it's so different for every person. And I think that this is something that is so individual, and the importance in the individual having the say in their own diagnosis can't be understated. And having a team of doctors that you are on the same team, if they bring up fibromyalgia and that feels right to you and that fits with your experience of your body, when you read that article online about fibromyalgia, it's like, that's me. Being able to have that on your chart is a shorthand way of expressing yourself to the next doctor and having them know who you are when you walk in the door. And it can be really, really helpful and really important. The inverse can also be true, where having fibromyalgia on your chart, for me, but back before my MCAS diagnosis, meant that a lot of doctors were unwilling to look at anything else. They just said, oh, well, you just have fibromyalgia. And I'm like, then why am I muscle spasming like crazy? And why do I need a wheelchair? That doesn't make sense with fibromyalgia, but they would ignore that because I already had that other diagnosis. Yes. So if you're with a doctor who's not on your team, it can be almost like a sentence to never get the right diagnosis, which is so upsetting. And then, so my experience with fibromyalgia is like polar opposite from what you've had, but both are 100% valid and both are important and both can help other people navigate their journeys by hearing our two different experiences. So it's just, another one of the reasons why chronic illness is infuriatingly frustrating.
Yes. Oh, yes.
Okay. I'm so curious about your Charcot-Marie-Tooth situation. This is a disease that we have not covered since, I think, episode 6, like right at the beginning of the show. My friend Brandon, who I used to play in a band with back in San Diego, has Charcot-Marie-Tooth. And I'm racking my memory because it's been years since we covered it. So am I remembering correctly that it is a form of muscular dystrophy?
So Charcot-Marie-Tooth, sorry, I'm just kind of looking up again because it's kind of, for a while, it was in my diagnosis saying, I think you have it. But then I did a few EMGs and they're like, no, it doesn't show that you have it. And then I actually went to UC, University of Cincinnati Health, that hospital. I saw a neurologist there, and he's told me, he goes, some can show up on EMGs, but some are also genetic. And so there is that genetic predisposition that you could have it as well. And so he is testing me currently because for the longest time, I just thought, all right, I just have neuropathy. Every EMG I've had shown anywhere from 70 to 85% of the nerves on the top of my feet are just dead. They don't there's no fast uptake. The bottom of my feet, I go through a lot of trials with it because I could be wearing a shoe that's uncomfortable. And then after I take my shoe off, I say, oh, I had a blister and I didn't realize it. So you have to be mindful of that. And then that's where this neurologist said, okay, it could be neuropathy, but it could also be Charcot-Marie-Tooth, which it kind of is similar to that. A big thing is that it's only really in the peripheral area, so your arms and legs. And it is similar to nerve damage. So essentially, it's a hereditary motor and sensory neuropathy, essentially. So it's why for so long they thought that I had neuropathy, but it's because my neurologist believes that I have this, that we call it CMT. It's why he thinks that I have it, because I've had both carpal tunnel releases, because I've had nerve pain, weakness in my hands to the point where I would drop dishes or I would not be able to grab something and it would shoot all the way up to the shoulders. Had to do EMGs for all of that. And so I've had releases in both hands, and now I'm dealing with the same pain, weakness, and everything in my left hand again. And so I went again for another EMG, and it shows, okay, well, there's still carpal tunnel issues. And the neurologist explained to me that this type of CMT, the genetic type, and I'll know exactly which type, hopefully, within the next month or so, because they're testing me for hundreds of different variations of it. It's a reoccurring thing. So it can cause like the carpal tunnel to come back and keep coming back, even though you've had a release done. So I think that one's been a bit more difficult because, like I said earlier, I love to do nail art, nail design. And so it's impacted that. And so that's where it's difficult. And then you kind of got to do, again, the mental health check because, one of your joys kind of gets taken away for a little bit. You have to find another variation of something.
Yeah, it's so hard when you're following your spirit and your heart is telling you, this is what I love and what I want to pursue. And then your body says, well, I don't think so. And that disconnect is so jarring. And I think, I've absolutely experienced that in a couple of different ways throughout my life, and it's very upsetting. And also, sometimes those things aren't linear, where, for me, I wasn't able to make music for years. My body was just in such rough shape, and I'm getting back to making music again now because I have a diagnosis and medication. And it's been very overwhelming to be like, oh, wow, my dream can live, but also I've lost years, and I'm rusty, and it kind of hurts. But I can do it.
Yes.
And I don't know, it's very complicated. I just popped back on our website. So this is from our episode with Brandon from May of 2021. And I actually, in the podcast description, I have this description of Charcot-Marie-Tooth. It says, this is a rare form of muscular dystrophy that causes damage to peripheral nerves. It manifests in a variety of ways depending on the individual, but generally causes degenerative muscle weakness and atrophy in the arms and legs. Yeah. So that's sort of it's a hard diagnosis. That's a scary thing to be circling.
Yes.
How does that feel to not know even if you have it or not, but to be within a month of maybe finding that out? I know that when I was looking for a diagnosis, when I didn't have a diagnosis, I kept saying, I don't care what it is. I just want to know. Tell me I have a degenerative disease. Just tell me what it is so that I know.
Yes.
And I know that can be a surprising attitude for an able-bodied person, but for someone living with the illness, you already have the illness. You can't get rid of it. It's already there. So knowing can arm you with power in a way that not knowing can make it feel like you don't know what to do next. How do you feel about it?
I think for me, I think I feel a little split because, like I said, it impacts my hands a lot. So I can't do a lot of the nail art that I like to do. But then also, I am grateful that it's just in the peripheral nerves. So it's just the arms and legs. So I don't have to worry about that progression to, having those difficulties being able to breathe, making sure that your heart is pumping, a lot of those things. So for me, it's a little bit of both. It's a bummer, but who's to say that once diagnosed, I won't be able to find some ways to accommodate myself, and I also, when I do have good days, I make sure that I kind of keep doing the things that I love, because those bad days, while they happen and they can last a few days, there's always that knowledge that, okay, this flare up will kind of slow down a little bit and I'll be able to get back to it. But I also find other things to do. If I'm having a rough day, it's nice. I can just pop over to my sister and brother-in-law's house, and I can see my nieces and nephews, and they're great to keep the spirits up. And it's just kind of a day-by-day thing, really. I think once diagnosed, it will be nice because then I can see a neurologist that would specialize in it. So in different neurology departments, you have so many neurologists, but they can specialize in different neurological disorders. So it's nice that once I'm diagnosed, I can go see a specialist for specifically Charcot-Marie-Tooth, and they'll be able to kind of get me on that path to help manage and regulate it. So that way it won't impact my everyday life as much as it is right now.
Yeah.
So for me, it's looking for that little bit of light at the end of the tunnel, because
absolutely,
whatever happens, I already have it. So
yeah,
it's
totally.
just how you manage.
Yeah. I'm trying to think back to the beginning of our discussion when when I asked you, what is your major pain? And you listed off your diagnoses.
Yes.
Are there any that we have not talked through, or did we cover them all?
So I also actually have endometriosis as well.
Right. Endometriosis. That's right. Yeah. When did you discover that you have endometriosis?
So that was back in 2011, and it was kind of interesting because, they thought I had it, but really the only way to confirm that you have it is doing an exploratory surgery to make, actually see it. Yeah. And with Ehlers and with POTS and everything, it's not the best idea to just be doing those kind of exploratory procedures. So the doctor went based on my symptoms. He believes I had it. But then as I was getting other conditions and getting diagnosed, we're like, okay, maybe I actually don't have it. And so I was, taking off medication. Unfortunately, it allowed it to grow. Oh. And so unfortunately in early 2021, I actually had an ovarian cyst rupture on me while at work. Oh my God. Wow. Yeah. So from there, then the doctor cleaned it up, everything. And he says, all right, we've confirmed you definitely have it. So now we need to do things to help manage it, which I guess, while sucks that it was kind of a rough experience with that, I'm just glad that I got that concrete confirmation that I do have it so that I can manage it. Yeah. And that's, I think, hard too, because it's hormonal and everything, and you don't realize how much of hormones can impact different things. Even with MCAS, having those kind of balance out properly is always important as well. So it's sometimes a juggling game, but
totally. I mean, you've been through so much, and you just seem so even-keeled and grateful.
Mhm.
And the things that you're telling me about your experiences are just, I could imagine someone else describing these and it being horrifying.
Yeah.
And coming from you, it sounds like, well, these are things that have been challenges, but I have found my way through them and I've found things to be grateful for. How do you keep yourself in that mindset?
I think it can be difficult. I don't ever say that I'm always this positive, going through therapy and everything and being able to do kind of mental health checks, and everyone will roll their eyes. Oh, yeah, you can say, oh, yeah, that helps or not. But until you find that kind of rhythm that clicks with you, because some people might not click with the cognitive behavioral. They may do a little bit more of a holistic approach,
Absolutely.
doing more of, essential oils. I'm sorry, they don't heal you, but they do have a good impact on mental health. Certain scents can bring back positive, happy memories. So you can implement those things when you're kind of trying to relax, have scents around you that give you happy memories. So I can't say, it's easy finding what is the best approach of therapy for you. But when you do find it, it helps kind of alleviate down the road those like dark spots which with all of our issues we can expect. But if you were prepared for it mentally, it's not as impactful. And I do have to say, I get a lot of it from my dad, because my mom, she does worry a bit more. And so I do get it from my dad. He's always been called like a cautiously optimistic person. He was an electrical engineer, so he's very scientific minded, but he also believed in therapy because he saw it from an analytical approach, saying if something can help improve a process or the way you're thinking, I don't see how it can be bad. And so that's why I always say there's always a good thing about, I guess, keeping mental health check on yourself. So when I'm going through these situations, I can say, all right, where am I at? If I'm having a bad day, I allow myself to have that bad day, but I don't allow myself to continue to have a bad day. So it's like, okay, today I can wallow, but tomorrow I may still feel upset, but I need to do one thing that would help me, like bring me joy, and then kind of add to it. And it doesn't have to be a physical thing. It doesn't have to be anything outrageous, just something small. And that's always been how I've approached these things. And then it kind of gets you and keeps you out of that funk. So that's how,
I love that. That's awesome. I've said similar things so many times that joy is cumulative. And if you find joy inside of these hard moments with chronic illness, you can live a happy life.
Yes.
And that's the thing that matters the most. So, yeah, I love that. Well, I have one more question for you.
Yes.
If you could go back in time, it sounds like your issues really kicked into high gear in high school. And you've lived this roller coaster of a health journey that you're still on, still waiting to find out if you have this other diagnosis, and you already have so many. But you've learned so much about how to be grateful and to live through positivity. And it's not toxic positivity. It is hard fought, practiced. I want to be happy and feel joy, so therefore I must find ways to do so type of positivity, which I really appreciate and resonate with. But if you could go back and address yourself when you were in high school, with what you have learned now, with hindsight, what is the message you would have shared with your young self about how to manage and how to get through this journey that you're about to go on?
I think the biggest thing that I would tell myself is what our family's kind of lived by, this motto of it's not the destination, it's the journey. It's how you handle yourself throughout this journey that you're going through. the biggest thing that I would say is that it's okay to feel what you feel when you feel it. And I really learned that losing my dad, because the grieving process is not the same for everybody. And, you're going to go through a different timeline than someone else. And so allowing myself to feel what I feel when I feel it sounds a little weird, but then doing something small to kind of get you out of that funk, essentially breaking that cycle. Doesn't have to be big, doesn't have to be long, just enough so that you can kind of realize that it's not the end of the world, that there is something else out there for you. And so you can keep that positive, I guess it's a little sliver of hope. And I also gonna kind of a little side note is that because I am born and raised Catholic, and so having a little bit of faith with it too is that it's difficult, but there are reasons that we're going through this, and we need to acknowledge that we may never know why, but you've got to keep that hope. You got to keep that strength with you, because it's not the end of the world. Everybody needs you in this world. So what you can do to help keep afloat is really what's best.
Wow. Well, Maureen, you've done such an incredible job on the podcast today. What a fun conversation. Again, I'm still surprised. And this is like the 4th year of doing this show, and I'm still surprised how fun it is to talk about these things that are so hard, and also just getting to talk to someone with one of my diagnoses as well is always so fun, But your journey is really incredible, and please stay in touch. I want to know what happens with this Charcot-Marie-Tooth diagnosis. And if you ever have updates that you want to share with us in the future, please let me know.
Of course.
Before we part today, if anyone in our audience wants to connect with you online, please let us know where to go, or anything else you'd like to plug.
So I do like to post. It's been a little while due to health issues and some surgeries, but I usually post anything nail art related, or even sometimes EDS related, on Instagram at aesthetically.maureen, just kind of showing things through my view of how I live life with all these diagnoses. And also, one of these days, I hope to be able to talk to more people, kind of help progress the medical field in terms of acknowledging that this is a real diagnosis. We may not look like we have a problem on the outside, where we may be able to handle our pain very well, but does not mean that we shouldn't be heard, and we shouldn't be given the same amount of care as someone who has a physical disability that's visible.
Yeah, so important. Amazing. Well, Maureen, thank you so much for coming on the show, and thank you to your mom for connecting us. I'm thrilled to be able to talk to you. What an incredible story. I'm so excited to share it. And it's great to meet you today.
You too.
Thanks for listening to this episode of Major Pain. I'm Jesse Mercury, your host and the producer of this podcast. Artwork by Egg Salad Salad. Our theme music is the song Time Machine from my synth-pop album Sci-Fi, now streaming everywhere. Support this show on social media: TikTok, Instagram, YouTube, and Facebook, all at Major Pain Podcast. If you have questions or comments you'd like to share with myself, our guests, or our listeners, send an email to majorpainpodcast@gmail.com. You can also visit our website to learn more about this show, support its creation, or comment on any episode at majorpainpodcast.com. Major Pain is supported by our listeners on Patreon. Thank you to our $2 per month supporters, our $7 per month patrons Naomi Adele Smith, Sonny Roberts, Kelsey Matson, Alexandria Henderson, Justin Minnick, Laura Stevens, Heather Muncie, and Robert, and our $25 per month producers Steve Kavanaugh, Chris Fowler, Trish O'Brien, and Hipster Leia. Learn how you can support this podcast while receiving special recognition on the show, gifts, and monthly bonus episodes at patreon.com/majorpainpodcasts.